Hi, Michael. How you doing today?
Hello, Wendy. Great, and yourself?
I'm doing well. I'm so excited to have you on the platform so you can really share your story with our audience. Why don't you
Thank
start off
you.
by telling people a little bit about yourself? Who is Michael Forbes?
Yes. So, I am a creative, a published author, writer, personal cook, chef, speaker, advocate, and an insurance industry individual between the 9 to 5. So, pretty much a little bit of everything. Yeah, here in Connecticut, born and raised. Currently living in Vernon, Connecticut area.
Yeah, awesome. I love that because you are like an all American man, right? Living
Yeah.
your life. And tell us when you were introduced to oncology or cancer. When did that journey start for you?
Yes, February 2021 was when I had the prostate cancer diagnosis. And actually, February 2021 is when I went for the biopsy. And then shortly after that, I had the diagnosis. And then I had the surgery for the prostatectomy April 2021, 4 days before my 40th birthday. So that was a happy birthday to me at the time.
Wow. Wow.
Yeah, so I was 39 initially when I was diagnosed. But prior to that, I was having ongoing issues with elevated PSA levels for quite some time. And I was just really thankful to have had a really proactive and engaged physician assistant at the time with my primary, Stephanie Barron. She was just very hands on. And if it wasn't for her monitoring PSA levels, I wouldn't even known because I didn't even know what a PSA level was. So I think just by having really hands on and proactive and engaged treatment care really helped me. And she was like, well, you know what? I need to refer you to a urologist to see what else is going on because your numbers are going up and down. First, we're thinking you're having inflammation. Then we're thinking maybe your prostate's enlarged, which is causing your numbers to go up. So we'll give you, medication. They gave me antibiotics to see if it will kind of like balance out, which it did. But then it went right back up once I got off of the antibiotics. So they knew it was a little bit more than just probably inflammation or an enlarged prostate. So thankfully, she did put the referral in. And then I went, and got treatment under the urologist, Dr. Stein, who's been amazing. And from there, we just continued to do um, blood work and continue to check the PSA levels. Um, and they were going up and down again. And then, they figured, okay, we'll give you some other prescription to help to see. And it got to a point where I was like, you know what? Hold up. I need further workup. Because I'm taking the medication, I'm taking these antibiotics, but my numbers are constantly going up and down. And then also I factored in I was already at high risk because it runs in my family on my mom's side. My grandfather, two of my uncles who are my mother's brothers treated for it. So I'm like I was already at high risk, so I factored in that, and then me having the ongoing issues over the years with just
Mhm.
the elevated levels and the discomfort and things like that. So thankfully, with my medical team and also me advocating for myself and my health, I was able to kind of push things along to get further treatment and further workup. So I was like, well, can I get further workup done just to see what's the next level? Because I've been doing the antibiotics, you've been monitoring the blood work, and it's still up and down. Secondly, I'm already high risk because it runs on my mom's side. So what else can we do just to see what's going on? And
Wow.
that's when he was like, well, we could do the biopsy to just see what's going on, but I'm sure it's gonna be fine. I'm sure because you're only 39. I'm like, look, let's do the biopsy. Let the biopsy speak. And sure enough, we did the biopsy, and it came back with showing cancer on um, both sides of the prostate. And
Wow.
then at that time, that was February 2021. So at that time, my doctor pushed the urologist. He pushed to have further treatment. He was like, "Well, these are your options. You're 39, going on 40. These are the best options for you. What do you want to do?" You know, and I was like, "Well, I want to just do what's best for me, you know, in my health in this moment." And he, you know, we talked about the surgery. We talked about different things at that time. So I said, okay, well, I'll move forward with the surgery. If we want to be aggressive with my treatment, you know, I'll do that. Um, you know, but it was a lot to really think about because, you know, once you have the surgery, it changes your life, like
Yeah.
literally, like,
Absolutely.
especially, you know, mentally and physically, you know. And me being so young, I'm like, well, you know, but then I was like, I also want to be healthy. I want to live a full, healthy life too, you know. So if I
Yeah.
gotta just adapt to a new way of life from a physical stance, I'm all for that as long as I get to be here to adapt to
Right.
it, you
Right.
know? So I
Yeah.
was looking at the bigger picture and the bigger scope of it for the future of myself and my health and life in general. So we you know we went on and had scheduled the surgery. I also did do a hormone shot
Hmm.
that I had as well around that time. So we did the surgery, the prostate hysterectomy. I had that. Um,
And that was
and
February of 2021.
that was the surgery was April 2021.
April
The
2021. The
February,
biopsy was February.
yes, February was the
Okay.
biopsy. So
Yeah, I
we
wanna I
moved.
wanna go back for I wanna go back for a minute because you said
Yeah,
a lot of very important things that I wanna highlight. One is
yes,
you were in your 30s, late 30s. Um,
yes.
how long were they monitoring your PSA when it was going up and down, taking antibiotics? How long was that process
It
with
was
your primary
about
care doctor? Mhm.
probably like 2 years.
2 years, okay. So I think
Yeah,
that's important because a lot of individuals in our society, especially a lot of, minorities,
right,
don't go to the doctor. So I think it
right.
really speaks to the importance of going for your wellness visits. A lot
Yes,
of even young people, it doesn't matter what their ethnicity is, they
right.
don't go for their annual, follow, especially being
Yeah,
young, I'm healthy, and then
right.
you also mentioned something about knowing your family history. You were educated. Like,
Yes,
you knew your mom, it runs on your mom's side. So that really speaks to the importance of knowing your family history because
yes,
it's in your DNA, it's in your genes, right?
right.
So definitely knowing that. And then again, you mentioned having the relationship with your PA, your physician assistant,
Hmm.
that she was really good. And, you guys had a relationship where she referred you.
Yes.
And then you advocated for yourself because if you didn't advocate for a further workup, you probably would not have been worked up.
Right, I would have probably still been on, you know, antibiotics and things like that. But to really, and it's no fault of my doctor. My doctor was amazing,
Mhm.
but I was his youngest patient at the time. He
Yep.
never had a 39-year-old, 40-year-old patient in that position. So it was shocking to him, you know, at the time because it was like, well, you know, normally he's treating 60, 70-year-old men
Mhm.
in that position. So he really didn't think initially that, well, it could be this, it could possibly these other factors because you're so young. But then, you know, when you think about me already being at high risk because of my family, you
Right.
know, then it's like, okay, well, you already at high risk, you know, based on that. But that's why it's so important that I think it should be a shift made from a medical standpoint when it comes to um screenings, because I know we have these various age limitations for screenings and what insurance covers and what it doesn't cover based on your age. But when we look at the healthcare now and look at various medical conditions, you see a shift in the age limit of who's being impacted. And it seems like a lot of it's getting younger than the
Mhm.
norm. So I
Absolutely.
think we have to look at the bigger picture of really kind of pushing for an adjustment when it comes to screenings, um, you know, for various conditions based on the person's age. Um,
Yeah, and I know with
yeah.
colon cancer, there was just some changes to that guideline where
Yeah.
colonoscopy being done at a younger age. I think it's 45, which
Right.
is great. But I think that speaks to the power of advocacy as well. You
Yeah.
said you're an advocate in your intro, is really having that lived experience, you being diagnosed so early, that's evidence, right?
Right.
That we definitely need to make change to those guidelines. So that's such a great point. Great point.
Absolutely. Absolutely. And I think just me in general, I've always been the one to go for my physicals and get blood work and see different various physicians in different areas just to stay on top of things, and whether it's things that I've already treated for or things that may have come up. I've always just been one to stay on top of things from a medical standpoint. So
Yeah, it's
um,
so important.
it is.
It's so important because that's usually the start of things. But if you're not going and you don't have a baseline, some people
Right.
haven't been to the doctor in years, especially with COVID. Many people have not had blood work or had their screenings, and
Right.
that's why we're seeing such an increase in cancers across the board and in all ethnicities, all ages. And now you're
Right.
probably seeing a lot of young people being diagnosed. And I believe it's biologics, also
Yeah.
environmental, but so important to know your history. So thank you so much for sharing that. And I would
Absolutely.
love to kind of explore the decision making in having surgery or not having surgery, weighing those options. How did you come to the decision to actually go through with the surgery?
Yeah. I just was looking at the bigger picture, and just like my livelihood in general, and just wanted to make sure that I was doing the best to really be aggressive, like the physicians was stating, with treatment and care. And I just felt that would be the best for me, being that I was young. Now, once I did have the surgery, I went, and a year later, I seen that my numbers slightly went back up, and I wasn't under zero anymore. I kind of had reservation, like, oh, I had the surgery, and okay, I did all that, and I'm thinking the surgery was going to be it, and that's not, the reality. you know, that was just a measurement of me taking treatment a step further. Um, but the reality was my numbers slightly went back up. So that's when I was referred to an oncologist. Now, actually, let me back up. The numbers slightly went back up. It wasn't too high, but after the surgery, I should have still been under zero. My numbers really shouldn't have went up, no matter how big of a difference. So when they went slightly back up, I was in a position to just weigh it out for like another 6 months to a year and keep doing blood work, or be referred for other treatment and workup. And again, I advocated for myself in that sense. I said, well, if my numbers went back up, they went back up. I had the surgery. What else? I don't want to wait 6 months to a year and double check. What can I do in between? And then that's when my urologist advised that I could be referred to an oncologist. And that's when, I was referred over to an oncologist, a great oncologist over at the Helen Grady uh, Cancer Center over at my Hartford Hospital. Great team, great nurse, great doctor. And then that's when we had a discussion about having the radiation treatment in the pelvic area. So I did that for 8 weeks, 5 days a week, 15 minutes. So I would go, first thing in the morning before work, and then come back and finish the workday. I did that for 8 weeks, 5 days a week, and then my numbers after the treatment, when we repeated blood work, they went back down under zero. Um, and then I had my follow up with them in January, this past January, and then I'll see them again January of next year for repeat blood work. And then the end of this month is when I will see my urologist for blood work, so he can be, in the loop of where I'm at currently since the radiation. So it was just, I just felt that the surgery, and then having additional workup with the radiation, it would just be best for me. Like the doctors were saying, being aggressive with my treatment since I was younger, since I am younger. I'm 43 now, so I was 39 at the time of the diagnosis, and then 4 days to turning 40, I had the surgery. So still fairly young compared to when you look at men in this position. you know. So I just wanted to be aggressive with it, and stay on top of things. It definitely was a mental, and still is at times, a mental battle, because it's a new way of life, literally, you know.
Yeah, I
My
wanted to
body,
ask about that before
yeah,
you went over to the oncologist, because a lot happened before you saw your medical oncologist. You were with the urologist and
yeah,
you know, introduced to the surgeon. When, if any, time did they offer you support, whether it was mental health support, an advocate, a navigator, a support
yes.
group? Did that ever happen? And if it did,
Mhm.
when? If it didn't, did you think it would it have helped in your journey before you broke? You had the diagnosis. You were diagnosed before you saw an oncologist when they did the biopsy. What
Yeah.
happened after that?
Yes. After the diagnosis and prior, like a month prior, probably 3 to 4 weeks prior to the surgery, I did get partnered with, you know, a care team and resources, to help. So prior to the surgery, I actually joined a virtual support group session, and then it was multiple doctors that spoke. It was other men in the forum at the time. This was through Hartford Hospital, who was just speaking on their past experiences, their treatment, how they feel, how they are now. So it was good to see different stories prior to me having the surgery and getting different perspectives. You know, and also me chiming in during the discussion and saying, well, you know, I'm younger than all you guys. You guys are in your 60s and 70s and 50s, and I'm 39, 40, and I'm having this surgery in another month. And so it was good to just see the different perspectives and different stories up to that point. And also for me to highlight my journey for these guys as well. Even though they already had the surgery at the time, I was getting prepared to have it. So I wanted to know what it was like, you know, firsthand. And everyone, you know, that was speaking just gave their side of their journey and how it's been from them. It was great to see the doctors speak and give insight on the procedure and after what happens and things like that. So I did have the resources provided to me, and then even with the oncologist team, I had a whole resource as well, in care team. So I've had that all the way through. Yeah.
Okay, was it just for you, or was it for you and your partner and your family? Because
Yeah.
did you look at the patient, but also like the caregiver,
Right.
family members? Were they also
Initially,
supportive?
yes. Initially, even with that support group that I had prior to the surgery, it was open for anybody to join. I think my mom actually had joined in on that call as well, from her home. So it was inclusive for everyone that was close to me, because it wasn't only just impacting me. Yeah, impacting me from a physical stance because I was the one going through it, but it was important for family to know and hear, you know, about different perspectives as well. So it was open, to anyone close to me who wanted to take part. Um, my partner at the time, we weren't together prior to my surgery. We got together after the fact. So I wasn't in a relationship with him prior to the diagnosis and the surgery. It was after the fact. He was with me hands on, actually, like as far as the radiation part piece of my treatment going forward up to now. Yeah. Um,
Nice.
so he's been a big support, and that's important. It's so important, especially like dealing with, you know, the physical aspects of it and an emotional stance and even spiritual. You know, just, you know, some days like I'm tired or I'm frustrated, and or, you know, it's so many pieces to it, that it doesn't necessarily just impact me, it impacts who you're also in relationship with. So having that support system and also having clear grounds of communication with each other is very important, and just being transparent, you know. I know when I did the radiation, and prior to the even started radiation, you know, you get a printout of things of how you'll be impacted, you know. So we sat down. I said, you know, this is what I'll be dealing with XYZ during and after. This is what changes. This is what we'll have to do to make adjustments. So I've been having him really looped in all the way. So there's no like questions or, you know, any confusion. And my partner's father dealt with prostate cancer. So he was already aware of it from, his father's doing great, now. So he was already, it wasn't something new to him because his father went through the same thing, the surgery. And so it wasn't anything new to him, but it's still, but now you're in a relationship with somebody that is going through it. So it's definitely, even though you're familiar with it, it's definitely still something that is going to be a big adjustment. But and again, that goes from a physical standpoint because I mean it impacts you physically, and I think that's what a lot of men who are in that position say, look, I don't want that. I don't want the surgery. I just rather naturally rock out and heal on my own naturally. And look, I would have did that too, but I'm looking at the full scope of it. Like, I
Yeah.
want to be here, and now
Hmm.
I rather take having a night where I'm not fully me and all my essence, if you know what I'm saying, than
Yes.
worrying about XYZ. Look, that's just an adjustment you're gonna have to make. I'm looking at the bigger picture of life. We can work around these different things in the
Right.
moment.
Right.
I'm looking at the bigger picture of my livelihood, of my life and my health. Not being able to perform in that one moment. Okay, there's other things we can do to make it work in this moment. So I think, and that's why that's what I hear a lot of guys who's in this position say they don't want the surgery, they don't want to do,
Yeah.
because they know how it impact them from a physical standpoint. And
Yeah.
when men, you got your ego, your pride, and I get that. Um, but you have to look at the reality of it. It's not that one moment in that night, you know. Yeah, yeah.
Yeah.
I just, and I get it because I'm a man myself, so I get it. I still go through those moments where
Mhm.
I'm hard on myself because of like just my body not functioning like it used to be, and it's a lot at times. It really is.
Yeah.
But then I also, like I said, I look at the full picture of just my life, and I
Yeah.
know that that one moment in the night is just that moment where I'm here. You
Right.
know.
I think you bring up a good point, and I commend your partner for coming in, after
Yeah.
after surgery and still willing because it speaks to
Mhm.
intimacy, right? Um,
Yes.
and we're talking about sex. Your
Yes.
sexual life is definitely impacted, um,
Yes.
by surgery and having radiation. But it's
Hmm.
really how do you um how do you show love? How are you becoming intimate with your partner? And there's
Right.
so many other ways besides
Yes.
actual sex,
Right.
so I
Yes.
think it's amazing that you have your partner, he's understanding, and you guys
Yeah.
are really thriving. That's amazing. I would love to speak to your experience, being part of the LGBTQ community,
Yes.
having cancer in the healthcare system, because there's a lot going
Hmm.
on now with that. We're
Yes.
talking a lot about diversity, equity, and inclusion. What was your
Hmm.
experience?
Um, it was it was good. I mean, I didn't feel any
Good.
difference. like
Good.
like I said, I've been blessed and fortunate to have a really great care team all around, even before the diagnosis. Just I've always been blessed and fortunate to have nurses and physician assistants and doctors really um on my side just in general. And just also me again advocating and being a big advocate for myself and overall. So I didn't really notice anything different about it from a treatment and care aspect, which is
Amazing.
good, because some
Yeah.
people may experience those, hiccups along the way. But I fortunately didn't have any difference through it all, even just being, part of the LGBTQ plus community. So I'm
Yeah.
fortunate, and and um, I speak on it, amongst my community itself about what I've been through, my journey, because people in my position who may be dating or navigating, love, and then dealing with this and then being part of the community, it can be a bit much. It can really be a bit much. I know for me, from a personal stance, I had that discussion with my partner. I was like, if there's something I'm not able to give you, I'm open for you to receive it outside of what I can give you, as long as
Mhm.
we communicate, and then as long as we have clear expectations and boundaries at hand. And he was just like adamant about, no, I'm with you, I'm rocking with you. There's nothing outside of what you can't give or what we can't have that I want elsewhere. We're gonna do what we have to do. And we're still going strong, a year and a half in. So he didn't run away. I didn't, so
Wow.
but with those conversations we had, and we still have them at times. Um, because if I just look at the picture of like, if there's something that I can't give you in that moment, I'm okay if you. He's like, look, no, I'm not doing that, But
Yeah.
we had those conversations, But as far as me being a part of the community and navigating the healthcare through this journey, I haven't had any like different treatment.
That's amazing. I think it's
Yeah.
important for people to hear that as well.
Yes, it is.
So that's amazing. And you speak. I'm thinking of character of your partner. I would
Yeah.
love to meet him.
Yes, you
So
have to.
that's amazing. And
Yeah.
you said something earlier about clear communication and transparency, and it seems like
Yes.
that's what you bring into your relationship, where it is very open.
Yes.
So that's amazing. And you said something a little early that I want to kind of go back to. You said that mentally and emotionally it was hard then, and it's still hard now.
Yes.
What are you dealing with now?
Yes. It's definitely still uh not a struggle, but it's still a tug of war, so to speak, at times. I have my moments where I'm like, oh my goodness, I miss the old way of life, in a sense of just like the physical aspect of it, because really, like, it's a new way of life. Like, your body is not how it once was. you know I
Mhm.
had to grieve and I had to mourn the loss of a life that I once had, and I had to, and a body that operated in one way that doesn't operate fully in that way anymore. So I really had to grieve and mourn that, and that's I still grieve and mourn that. It's still a process. I'm more at peace though now, being that I have like my support system, and also knowing that I'm doing what's best for me from a health standpoint. But
Yeah.
it's still, as a man, it's still very challenging. It's still hard, not just just not operating the way I used to operate fully. And it's not just like parts of my body, it's all aspects of it. Sometimes I'm tired, sometimes I have fatigue, and and so it's different things in that regards. You like urination, having to use the bathroom quite a bit sometimes, like, so it's different pieces of it. And I'm like, well, if I didn't have to go through this, I wouldn't have to deal with that. But then I remind myself, I'm here. I'm
Right.
here, like, in the physical. God is still blessing me and affording me life. So I have to come back and remind myself and check myself, like, look, Mike, yeah, you're you're grieving and mourning how it used to be, but how it used to be wasn't really fully healthy.
Right.
That, so like, I'm healthier now, in a better position, but as a man, you still have those challenges where it eats at your mind a little bit, and
Yeah.
your ego. So that's the ongoing piece of it. But again, like I said, I just keep reminding myself of the bigger picture, that I'm here.
Yeah. Are you part of like a support group, or are you in therapy,
I'm
or
in therapy,
'cause-
yes, and I have
okay.
an amazing therapist. I actually been with her for about 8 years,
Oh, that's amazing.
and she's great. I see her every 3 weeks. We have a session every 3 weeks. Our sessions now are more so like check-ins because I'm in a better position from a mental space. But we keep it going every 3 weeks. We're on the calendar. So she's been a big help as well. Just keeping me in alignment. And I there are support groups that I'm aware of. I haven't taken part in any of them really. I'm so busy between outside of work. But I have the resources if I do need, and I feel that I need to, I have them readily available to access them. So yeah, I'm in therapy every 3 weeks. We have our hour session. And then just my support system of family and friends, and my partner. Yeah,
I love it. So you only had radiation, no chemo,
just radiation. Yes.
just radiation.
Yeah.
Okay. No, that's good. So what are you doing now? How are you sharing your gifts with the world outside of cancer?
Yeah, just I'm continue writing. Book number two is finalizing. So that will be hopefully I'm aiming towards next year. So that um I've been doing a few podcast interviews, speaking lately.
Nice.
Um Everything, outside of the 9 to 5, I've really just been trying to be present, and yeah,
And I
just
saw something about uh cooking, chefing. Tell us more
yes,
about
yes, yes,
that.
yes. That just kicked off recently. Forbes Kitchen.
Yeah.
Um, so with that, I have farm to table organic produce. I have a plot of land that I rent in my town here in Vernon, part of the community garden. So I'm growing all types of organic vegetables. Um, so with Forbes Kitchen, I want to really push sustainable living,
Yes.
and then tie in farm to table and personal chef, personal cooking, and catering services. So that's my big thing next that I'll be doing as well. So between that, the writing, the speaking, I try to tie my passions in some way, and that's
Yeah.
also therapeutic for me.
Yeah.
It's doing things that really bring a sense of joy to me. And cooking does that, and being outside in the garden and connecting with you know the fruits of my labor and getting in dirty and just absorbing the sunlight, like that's all therapeutic and healing to me, so that's why I find it important for me to dive into these little things outside of my corporate job where I can kind of stay balanced and stay in alignment with myself.
Yeah.
Yeah, so Forbes Kitchen, my writing book number two, and my speaking engagements. Yeah.
I love that because it speaks to life after cancer treatment, right? And
Right,
that
right.
cancer doesn't really define you.
Right.
However, it gives you new perspective, new purpose,
Yes.
new appreciation
Yes.
for life. So
It does.
before we wrap up, I would love, if you have a message for people watching, people who may be a cancer patient, may not be a cancer patient, maybe a caregiver. What are some things you want to kind of leave them with?
Yes, I would just say the first thing, in general, no matter if you are a cancer patient, not a survivor, are just part of a network of people. Um, just in general, when it comes to you and your health, be your biggest advocate for yourself, as you navigate, you know, life and the healthcare system and medical for yourself. Be your biggest advocate, because sometimes you have to ask for that extra push and boost in general, no matter what it is you may be dealing with. So please advocate for yourself in all aspects, and also have a support system, whether it's close circle of friends, family, um, and a medical team and staff that's really hands on. It's important, that support system and support circle, and also just know that we have this one life in the physical, this one life in the physical. So do what you have to do that's best for you, and that's just it. Do what's best for you, what's best for your livelihood, what's best for your mental, emotional, spiritual well-being, and know that sometimes doing what's best for you will disappoint others, but that's okay because it's
Ooh,
about you first and foremost. So rock out, stay grounded, stay in alignment, and know that it gets better. It may look cloudy and muddy at times, trust me, but
yeah.
know that it gets better, and that you're doing what's best for you. You know.
I love that. Do what's best for you, even though others may not agree or may not be happy. I
Yeah.
love that. Now that is a whole nother session.
Right. Listen, yes, it is because some people will challenge you
Oh yeah, for sure.
based on
For
your
sure.
decisions, no matter what it is. But at the end of the day, you have to do what's best for you, and look at the bigger picture. And I think I said that quite a bit during this discussion.
Yeah.
Me seeing the bigger picture and the bigger perspective of it, which is life, and me being here and being present. So my decisions may disappoint someone, but hey, it is what it is. It's what's best for me in that moment.
Absolutely. I love that. And I think this is a good time to wrap. And I would love to have you back on the platform to see how you're doing in
Absolutely.
a few months. This was amazing. So thank you so much for sharing your story and being so open with our audience. Really appreciate it.
Thank you, Wendy, for having me, and continue doing great things within the community and from the medical standpoint. I mean, between your book and you recently completing your doctorates and just really rocking out with the collaborative cancer care piece of just it's amazing. You're doing so much, and I'm just so happy of everything you're doing, and you're really a blessing to a lot of us. So keep doing what you're doing, and keep shining your light for all of us.
Thank you so much. I appreciate that.
Anytime.